the benefits as an SAA and fellowship recipient. To those that are just joining, we're giving everyone another minute or two to join, and then we will begin. Okay, to be mindful of everyone's time, it's 4:02. So I'm going to go ahead and get started. Again, my name is Melissa Williams. I'm with Indiana University Human Resources, and I'm here today to discuss the SAA and fellowship recipient benefits to those that are eligible for the fall 2024 semester. So during this presentation, we will be going over some general information. We will discuss your benefits at IU and also allow some time for questions at the end that any of you may have. So to start off just with some basic information, new for the 24-25 academic year, the university was able to work with Anthem and UHP to align our 4 existing student plans, which are our international students, our professional students, as well as our SAAs or student academic appointees, and our fellowship recipients. In addition to that, we were also able to add a new voluntary domestic plan to individuals that do not fall into the eligibility requirements for the other plans. One thing about this is it helps us to be able to have an improved plan performance. It reduces some administrative overhead to the university and the financial liability. One thing to note is obviously that the cost of these benefits for SAs and fellowship recipients, your premiums are covered by the university. And while we do our best to keep those rates low just for the university, it does impact our ability. And Indiana is one of the most expensive states in the country for health insurance. So to again keep those costs lower for the university and to benefit our students, we were able to do this redesign. Some other benefits to this redesign were we were able to reduce that plan disruption. So on occasion, we'll have individuals that go between an SAA and a fellowship. And under the prior way of administering the benefits that could actually cause disruption to students, where they would have to get new ID cards and potentially deal with getting new prescriptions for certain medications, or if there were authorizations for services. It also allowed the university to increase the affordability for students that elect to cover family members on their plan. We were able to reduce the premiums for dependents by approximately 68%. And we were also able to reduce the copay for the IU Student Health Center on campus from 25 to 35, or I'm sorry, from $25 to just $15 per visit. We were also able to align this with the academic year. So prior to this academic year, the deductibles, which I'll discuss in this plan, actually has a $0 deductible, but that, as well as the out-of-pocket limits, would reset in January. So in the middle of the academic year, well, now they are resetting on August 1st for you. As I noted previously, this also allowed us to offer a new voluntary plan that provides much of the same benefits that you guys are receiving as SAAs and fellowship recipients. As I said, Anthem is who the university partners with, and they have partnered with UHP, United University Health Plans, to help manage the administrative services. This acts as a central hub for you, the students, to access your benefits. Not only does it continue to give you your medical, vision, prescription, dental, and the emergency travel, but it is all with Anthem instead of having separate benefits under more than one vendor. It still has that same national as well as global provider network. And you can actually go to universityhealthplans.com, Indiana, to find plan documents, see the premiums. If you have dependents or want to waive that coverage during the enrollment period, you do have that option as well. To be eligible for these plans as an SAA, you must be working at a 15 hours or more per week, which equals 37.5 FTE or greater, or we do have appointed postdocs who are working on T32s. Additionally, to be an eligible fellowship recipient, you have to be enrolled in a minimum of 6 credit hours and also receiving an award of 6,750 more per semester. So that's for the fall and then again for the spring semester. And those credit hours apply to both the SAA and fellowships. As I previously noted, your premiums are for your coverage are fully paid by the university. You are enrolled automatically. There's no enrollment form that is required for your enrollment. Obviously, this is now after the deadline, but for those individuals that do have other coverage and don't wish to be enrolled on the university plan, there is an option to submit a waiver by September 15th for the fall, and in the spring, it is January 31st. As I noted, the coverage periods fall in line with the academic year. So the fall coverage period is August 1st through December 31st, and the spring is January 1st through July 31st. You are automatically enrolled from the date that your appointment begins or the beginning of the semester. Your coverage is not activated until your contract is either in the IU system or your award has been put and dispersed on your Bursar account. As I say, you must be registered in a minimum of 6 credit hours, and your coverage does end at the end of the semester in which your appointment or your award ends. As stated, you do have the option to enroll a spouse or dependent child under the age of 26 on your plan. You are required to provide documentation to support that eligibility. That would be a birth certificate for a child, marriage certificate for a spouse. Your dependents can only be covered at the same time as you, or if you experience a qualifying life event, which I will discuss later. and you can enroll those dependents within 30 days of your eligibility period during open enrollment, or if you experience that qualifying IRS life event, you have 30 days. The premiums to add your spouse are paid for, you can pay for them on a semester basis, an annual basis, or you can actually set up a monthly withdrawal for your dependent premiums. To cover one dependent, it is $1,850.67 per for the fall, and then again, the spring is that $2,564.33. As you add dependents, the cost does increase. And if you have 3 or more dependents, that would be where your cutoff is. The premiums, as I said, are paid for by you at the time of your enrollment, and they can be paid in full or by monthly installments. The enrollment is done via the online portal on UHP's website. And if there is an issue, just reach out to our office with assistance. You can access your plan ID cards. This would be either your medical and prescription ID card or dental and vision card by visiting either anthem.com or downloading the Sydney Health app and entering your information. There are 2 digital ID cards available to you, and you would use those when receiving any services from a provider. Now we will jump into a little bit more about your actual medical benefits. So Anthem is who administers this coverage, and this plan is comprehensive. That means your office visits, hospitalizations, transplants, prescriptions, all of those things are covered. Your plan will cover any in-network preventative services at 100%. This would be your annual physicals, routine exams, cancer screenings, lactation support, as well as most women's medical contraceptives and birth control pills. Under this plan, there is no pre-existing conditions, exclusions, or limits. There are no lifetime limits. You have both copays and coinsurance that will accumulate towards the out-of-pocket maximum. For those that maybe this is your first time having insurance, an out-of-pocket maximum is the most that you will pay for in-network coverage services for the plan period, so for the academic year. If you reach that out-of-pocket maximum, the insurance will pay 100% of services after that are covered. As I said, the plan begins annually each August 1st, and at that time, the limits and maximums do reset. Your benefits for the state of Indiana are where you can find your networks are the Blue Access PPO. Nationally, it's Blue Card PPO, and then overseas, it's the Blue Cross Blue Shield Global Core. In addition to finding in-network providers, you also have access to the 24/7 Live Health online telehealth. And again, you can use anthem.com or the Sydney Health app to find in-network providers. As I stated, this plan has a $0 deductible for in-network services. You have an out-of-pocket maximum of $2,500 for an individual or $5,000 for a family. Student Health Center is a $15 copay. If you go to a primary care or specialist, it is either a $25 or $35 copay. If you do have to be hospitalized, you have a $200 facility charge plus a 20% co-insurance. ER visits are $150. Urgent care is $50, and most diagnostic x-ray services and other services are a 20% co-insurance. If you do have to go out of network, you can see that you do have an annual deductible of $500 or $1,000, and then the out-of-pocket maximums of $5,000 or $10,000. And all other services are a 50% coinsurance after the deductible is met, but the ER still remains that $150 copay. If you do have to be hospitalized after an ER visit or during an ER visit, that copay is waived. You've heard me talk about the Sydney Health app to access care. Well, in addition to being able to access your digital ID card and find care, you can visit with that providers via the Live Health Online, and you can also check to see where you are at in your out-of-pocket maximum, or you can look at claims. The Sydney Health app is available both through the App Store as well as Google Play. And you can also go to sydneyhealth.com to download that as well. Now we'll speak a little bit about your prescriptions. So for your prescriptions, you have copays based on the tier that your prescriptions fall within. Retail, this would be going to your regular brick and mortar pharmacy. You can get a 30-day supply at either $10, $40, or $75. Mail order, you get up to a 90-day supply at a discounted rate. So as you can see, a 90-day supply would be either 20, 80, or 150. So you save about a month each 3 months by doing the mail order. Additionally, you have specialty medications. That is a 30-day supply, and it is $150, and all specialty meds can only be filled through that mail order option. Again, you can go online to anthem.com or the Sydney Health app to locate in-network providers, and also you can review your pharmacy formulary or your drug formularies and more by visiting there, such as reviewing claims. We'll talk a little bit about your vision benefits. So your vision is part of your medical plan, and it is with Anthem's Blueview Vision. You use that same digital ID card when you're visiting in-network providers. There are no out-of-network benefits under this plan. You get one routine eye exam every 12 months with a $20 copay. And if you need glasses, frames, or contacts, either or, you can get a discount on those every 12 months. You can see there's a list of providers that are in network. This includes obviously the School of Optometry here on campus, as well as Provision, 1-800 contacts, and many independent eye care professionals in the area. Your dental benefits. So again, as I said, this is all with Anthem this year. And so Anthem uses the nationwide Anthem Complete Dental Network. They have a $25 deductible per member for your in-network benefits. This is not applied to your preventative care. So your 2 routine cleans and exams are covered at 100%. Any other services, basic and major, are covered at 50% after the $25 deductible, and it does have an annual benefit limit of $500 per covered member. If you go to an out-of-network dental provider, you can be billed up to the usual and reasonable, and you would be responsible for any balance billing. You can visit anthem.com to find in-network dental providers. One thing I will note is, in my experience for dental benefits, the in and out of network doesn't have the same impact as under medical. For instance, my dental provider is not in network, and I pay about $3 for my cleaning versus paying 100% of that. So now we will talk about some of the other benefits. You guys have travel assistance. This is with Academic Emergency Services, also known as AES. These benefits are available to you 24/7. They have medical evac and repatriation. You have a $25,000 AD&D benefit. This is if something were to happen in an accident where you are to lose your life and or it sounds morbid, but our appendages can have a percentage of that tied to them that would be a payout if something were to occur in an accident. You also have emergency travel arrangements. If you are traveling and lose your prescription or your eyeglasses, you can get assistance with replacing those. They can also help you to find out what is coming if you need to travel and check any requirements. They can also help with interpretation, referrals for providers, and legal consult and bail bonds assist. I always recommend that if you are traveling, especially out of the US, to make a copy of this travel assistance flyer that can be found on the website and provide that to somebody in the States. So if something were to happen in an accident they can help you to get any assistance if for some reason you are not able to help yourself in that way. A few other benefits to talk about. You have access to a 24-hour nurse line. These are registered nurses that are available to provide 24/7 guidance on non-emergency health questions and concerns. They can help find providers. This obviously does not replace a doctor's care. And if you have a true emergency, call 911. We spoke about it a little bit before. You have access to Live Health Online. This is a $25 cost per visit where you can actually access board certified doctors 24/7, either through your smartphone, tablet, computer with webcam. They actually have the ability to diagnose and even send prescriptions if necessary. Again, this is not a replacement for your regular care through your primary care physician, but does help you out, especially when traveling or if it's after regular business hours. Well, we're just getting into the start of the new year, but when you are no longer eligible for enrollment on this plan, you do have the option for continuation. So when you no longer meet the eligibility requirements, you do have the option to elect up to 3 months of coverage for yourself and any dependents if they are covered under your plan. You have 30 days from the day your coverage ends, so that would be the end of the semester, to elect to enroll in the continuation. And you will receive an email to your IU email address notifying you of the ability to make that election. The premiums are paid at the time of enrollment, and when you make your election, it is a one-time election, so you can elect either 1, 2, or 3 months at that time, but you are not able to, once you've made that election, you're not able to go back and change that after it has been submitted and has passed that 30-day mark. If you are working and receiving a paycheck, so this would be all employees who are receiving compensation, you do have the option to enroll in the IU 457B retirement plan. It is completely voluntary. There is not an automatic enrollment. There are also no matching for this. You make all the contributions and you can select the investments. You can visit our website to see more information on this benefit as well. And with that, I have reached the end of the presentation. Here are our links to both our email as well as our benefits site through UHP and our phone number. If there are any questions, I think it is a fairly small group, so you can either type them in the chat, or if you feel comfortable coming off the mute, you are welcome to do that as well.
Hi, Melissa. I don't have any questions right now. I just wanted to say thank you. I'm with GPSG, and we're just really glad we could put this presentation together and get this out to more students.
Absolutely.
Very thorough presentation. So thank you so much.
Absolutely. We are happy to help and, spread the word about these benefits. So we do our best to get the information out, but it's always helpful to work with your group as well to get this out to students. So appreciate the opportunity to do this.
Since I'm not seeing any questions in the chat and I haven't seen anybody unmute, I know you covered medications. Something that has come up to us with GPSG members is there's been, as I understand it, a change to prescription coverage. A lot of students have reported back to me and Mackenzie, who's the president of GPSG, that their prescription plan changed or they lost some coverage to the prescriptions they had. I'm assuming that is because of a renegotiation with the insurance companies. But is there overall a net change with prescription coverage for students?
Sure. I'm happy to touch on that. So unfortunately, actually prescription can come on and off of plans at any time. So it's not something that we really have any true say so in. So prescriptions can be affected at any time throughout the year. There were some changes just based on how the plan is run and the negotiations between the two, moving from one type of plan to another. If students are experiencing that, our office is happy to look at their specific cases and see how we can provide assistance to them. We've found that for some, it's likely that there was an authorization that maybe had not been submitted or something along that nature. But again, we are happy to work with individuals on a case-by-case basis to see how we can best assist them to see what we are able to provide to them.
Thank you.
And for those that didn't see in the chat, they will also be posting this recording to share with other individuals as well. Are there any other questions that I can help answer? Again, and if it's a personal question that you don't necessarily want to share during this presentation, you're always welcome to email our office, call our office, and we will do our best to assist you and get back to you as quickly as we can with any assistance. And yes, the studenthc@iu.edu is the email. Seeing any, and I don't want to keep everyone. It's 4:30 on a Tuesday, so I appreciate all of you for attending and hope that we provided the information. And again, if you have any questions, please feel free to reach out. We're happy to help.
Alrighty, thank you again, Melissa. We will be sure that we get the video recording shared with our GPSG members, and then any questions they have, of course, we'll send them your way, and hopefully we can pre-package them or in any way make it work for everybody. So thank you so much for doing this today, and thank you everybody for joining.
Absolutely. Like I said, we are happy to do it and happy to help how we can to get this information out to the people that need it.
Thanks, everybody. Y'all have a great day.
You too. Thank you.